day of my surgery, I had to go up like the day before, obviously, in the morning. It was kind of like a long day, just like bloods, weight, height. Had to speak to the doctor, look at the surgeon who was doing it and that. And then it was like the next day of my surgery. I think kind of all in it worked out, I was down there about 4 hours, 4.5 hours. I remember like a couple of hours later I was still kind of in and out of it because of the surgery, and I remember the nurses like talking like during the shift change, you know how they update like the patients, and I remember them saying about hysterectomy, and even though I was kind of out of it, I just remember thinking like, oh my god, hysterectomy, that's it, they found cancer. So the day after my surgery, the doctor came round to speak to me, and he told me that they had found cancer on my ovary, and he staged me at stage 1C. He said he wouldn't know, they had to take obviously like microscopic tests and things like that, so they wouldn't know the full results until about a week and a half later. I remember getting in trouble with the nurses. I don't like hospitals at the best of times, I really don't like them, I don't like needles. And I remember a couple of days later, I was on the ward obviously recovering, and the ward I was on, it was like kind of for ovarian cancer patients basically. And I remember a few days later and I was just so upset, but it wasn't upset about the diagnosis, it was more, I was upset because I was on this ward with all these people, and it was all older women, like kind of like 50s, 60s, somewhere in their 70s, and I was on this ward with all these people that I didn't obviously know and speak to. I was missing the kids, and I felt like every time somebody spoke to me, I just wanted to kind of burst into tears. And I remember on the Sunday night after the doctors had been round, I was just like, I want to go home, and they were like, you've just had major surgery, you can't go home a few more days. And I had like my drain and the drip and things like that out by then, and I wasn't, even though I was still in a lot of pain, I wasn't on as much pain medication as I was when I'd first got it, and I was just like, nope, I need to go home, discharge me. And they're like, we can't, blah blah blah, and I was just like, I don't care, give me painkillers, I want to go home. And I discharged myself. The doctor wasn't too happy and she kept kind of giving me dirty looks, but I was just like, they had checked me all over, and the way I seen it was the wound was healing fine. I was still in pain, but I could have painkillers at home. All I was doing was lying in a bed. My mum had the kid like at hers, so when I went home I didn't have to kind of like run about after the kids or anything like that, so I was just like, nope, I want to go home. So it worked out in the end. I had my surgery on the 6th of May and I discharged myself on the 9th of May that night. But I mean, I'll be honest, when I went home it was a lot easier being at home because I could like, I was like lying on a couch recovering, but the kids weren't there, so I could still kind of like take it easy in that. So I had discharged myself on the 9th of May. I went home and I was recovering. I got the appointment for to go and see my surgeon on the 19th of May, and I was a bit gutted about that because the 19th of May is my son's birthday. He was 3 that day, and I kind of had to spend like kind of the morning with him, and then I had to kind of leave and go up to my hospital appointment. But I went up there and the results weren't too good. He said to me that, I've got it here just in case I look down, sorry. He said to me that the cyst had completely covered my left ovary, and there was a tumour inside. There was a tiny pinprick like in the cyst itself, and it was leaking fluid into my abdomen. So he said he removed litres and litres and litres of the stuff. He said it just kept coming. He said there was just so much of it. He said that would have been partly all the weight gain I had put on, especially being all at the front. He said that when the tests had came back, they had found microscopic cells in my omentum, but he said because he had found microscopic cells in that, it just bumped me right up, and he re-diagnosed me at stage 3A. So that was me. I was diagnosed with 3A, and because obviously there is microscopic cells, that I would need to definitely have chemo, whereas before he wasn't too sure. He thought I would maybe need to have it, but he was waiting on the tests coming back. But because it had bumped me up to stage 3A, I would definitely need to have it without question. He told me, I asked him, was it a full hysterectomy that he had done? And he said it was. Unfortunately, they couldn't avoid it. So he removed my 2 ovaries, my fallopian tubes, my womb, my cervix, my omentum, my appendix, and also 3 lymph nodes. He just wanted to check the lymph nodes to make sure the cells hadn't obviously gotten to them. Yep, so that was a total hysterectomy I had to have. I'm kind of glad that when we spoke it over, I decided to go with that, because if I had chose like the first option, it would have kind of like closed me back up. I would have had to recover, and I would have definitely needed to go back for surgery to get rid of all that fluid and like remove everything and have the hysterectomy. I'm kind of glad in that sense that I had just decided to go for it. So after I had spoke to him, I kind of spoke to like it was like a kind of support nurse, and she just kind of went through basically everything, like how my chemo would work, how many weeks I would have it, and like kind of she gave me like loads of like information and leaflets and booklets and things like that. After I spoke to her, I kind of went and spoke to another doctor, but this doctor specialised in the chemotherapy, so I would like see her like the day before my chemotherapy, to obviously make sure I was fit for my chemo. She would like take my bloods and things like that. I was told there and then that I would be having chemotherapy. It would work out every 3rd Friday, but I would have to go up the day before, have bloods, and obviously make sure that I was kind of fitting well to have the chemo the next day. The day I have my chemo, it was like kind of 8-9 hour day, so I would need to be up there for like 9 o'clock in the morning, and probably about 4 or 5 o'clock ish before I would be finished. She said to me, she offered me the chance to have for to take tablets as part of a clinical trial. She explained I didn't have to, it was really up to me, but it was really obviously just like to take part in it. It could help, it might not. I decided to take part in it, mostly because they check up on you a little bit more when you're part of the clinical. When I was part of the clinical trial, you kind of had to go beforehand and have a lot of tests and test your liver and your kidneys, but then like also throughout the time of the trial, I think it's like 2 years, you kind of like had a lot more like CT scans and things like that, so I kind of liked that because it kept a closer eye on you. So the chemotherapy they decided to give me was carboplatin and paclitaxel, and I had to have that every 3 weeks. I had my first chemotherapy on the 11th of June, which was like a week before my 29th birthday. So I remember the first day I was getting in for it, and I was kind of gutted because it was my daughter's sports day and I had to miss it, and obviously she understood, but she was only 7 at the time, so it was more me, and I was like, I didn't want to miss it, but I had to go. The only thing about the chemotherapy is it's a long drawn out day. I mean, you're up there for 9 o'clock in the morning, and it's like you had to have like all these steroids and anti-sickness tablets before they even gave you the chemo. I mean, sometimes like when my chemo fell, I didn't get out of there until like 6 o'clock. It was a long day, and even though you can take things with you or you can have a sleep, you're just sitting in this chair with this drip in your arm, and it's just like you're tired, but you're tired because you're not doing anything, if that makes sense. I found it The chemotherapy, I didn't find it too hard, even though it kind of made me tired and things like that. I'd always imagined, like, when you see it on television and, like, you're, like, bedridden and, like, sickness all the time, and I was really, like, dreading it beforehand, and I was like, how am I going to cope with my 2 kids, my 3-year-old and my 7-year-old? I mean, obviously, my family and that helped, but I was like, I still, like, obviously I had to get up and feed them, and, you know, I couldn't kind of, like, not do it, especially with the age of my youngest. And I was just like, what if I'm going to be bedridden? What if it's going to, you know? And I was actually not too bad with it. I mean, there was a few times that, like, kind of like tiredness and kind of like, it wasn't actually sickness, it was more like nausea, but it was actually not too bad. It wasn't until the end of July that I started having a really hard time with it. I started to get not well, and I had to be admitted to hospital. I had a low blood count, so it was like I had to be kept in isolation, and it wasn't fun. I was in this wee room myself, and anybody coming up to see me had to put like the mask and the gown and the gloves and all that on, so they didn't give me anything, like any infections. And I just absolutely hated it. I was in there, I think, just over a week, and it was just, I hated it so much. I was like, I can't do this. I mean, it eventually got to the stage, and I got home, and I was like, I never want to go back into hospital again. Since after that, I kind of started having a lot of trouble with kind of like my bloods and my immune system and things like that. Twice or 3 times my chemotherapy had to be like kind of like postponed. I had went up the day before to get bloods took, and my neutrophils, which is like my blood count, was like too low to have the chemo. In 2 separate occasions I had to get injections from the doctor, and I was like, ah, that's fine, doctor gives it. No, you had to actually inject yourself at home, and I was like, I remember the first time having to do it, and I think it took me about 20 minutes to pluck up the courage to actually like stab myself in the leg with it, and I was like, oh my god. You know, it's just one of the things, and you need to do it. The way I looked at it is, I had to do it. I mean, I think the first 2 I got my mum to do, and then I was like, nah, I just need to suck it up, stab myself, a couple of seconds, it's done. I have always had long hair, really long hair, always. I've never had it short. And I was kind of dreading it all falling out. I didn't mind kind of going and getting it cut a bit shorter, but when it actually started kind of falling out, when it started falling out, I was kind of glad to kind of like shave it myself, because my head was all kind of like, all your follicles and your skull and everything is really tingly and sore. So I decided, I went and got it cut into a bob just after my first chemo, but then like just before my second one, it started coming out in clumps, so I got the razor and I just shaved it all off myself. I wanted it gone, and I wanted it to be on my terms. Even though it was falling out in clumps already, I didn't want it to be like some long, some fell out kind of thing, so I wanted it to be on my terms. That I just got the buzzer, shaved it all off, and that was it. I did offer the option of like kind of cold cap treatment, but I really just didn't fancy that. You had to kind of sit all the hours we're having chemo with this kind of cold cap on your head, and I was like, nah. Actually, I'd got a wig, and my plan was to wear the wig, and I think I had it on once or twice, and I absolutely hated it. It was so hot and so itchy, and I was more paranoid wearing that people knew that it was a wig. So I decided to I bought some scarves, like head scarves, and I just used them. That was easier for me, especially kind of like when I'm having like the hysterectomy. It put me obviously straight away into like the menopause, so like with hot flashes and things like that, it was a lot easier to kind of like your headscarves, because you could get like cotton ones so you could keep cool. I remember actually laughing with my friend one day because I didn't have to shave my legs or my underarms, and I was just like, yes, gives me a break from doing it. But you had to have a sense of humour at that time. I mean, quite a lot of people, like family and friends, used to always say to me, how do you manage it? You've got 2 kids, how do you do it? And all I could say was, you've got to do it. I mean, I couldn't lie in my bed all day and I couldn't wallow. I had 2 kids that needed me. They had to be fed. My daughter had to be up for school. It was just, you had to get on with it. I think there was maybe only once that I actually maybe broke down crying, and it was just like, you pick yourself up and you get on with it. There's nothing else you could do really. So I had my last chemo on the 8th of October. After I had my last chemo, I had quite a lot of kind of like CT scans and scans to check like my kidneys and my liver and things like that. And my first appointment like with my oncologist was the 25th of November 2010. So it was about 6 months after I was first diagnosed, and I'm so grateful that she said that that was me. She classed me as NAD, which is like no evidence of disease. So I just remember my friend came up with me, I just busted out crying, and I was so happy. It was just, I mean, not a lot of people kind of have got the all clear straight away. But I did. I mean, 6 months later, and that was me. I have checkups, it's like every month, then it goes to like 3 months, 6 month yearlies. At a couple of appointments, there was like, I had like a lot of pain and things like that, and I was like, the least wee bit of pain, I was panicking, thinking, oh my god, it's back, or you know. But no, I mean, there was one appointment when she'd done a scan and they showed like a spot on my lung, but she said it was so tiny that it wasn't worthwhile doing the chemo. They would need to wait and see if maybe it get bigger or anything else. But by the time my next scan came round, it had gone. So fingers crossed. I mean, this is me now 6 years out, and it's not come back once. I've not really had any problems, like after problems with it. I still get some pain from my surgery, but my doctor seems to think it's just like scar tissue on the inside with being major surgery. So there's really nothing they can kind of do about that. You know, I don't want to kind of go and have surgery to get rid of the scar tissue, but then obviously the surgery I'm having is going to cause more scar tissue in the long run. So my checkups now, because it's so far out, they've changed now to every 6 months, and without fail, see when that appointment comes round, honest to God, I'm absolutely a nervous wreck. The feeling that, oh my god, is it back? It never goes away. And I think the further I go out, like, it's not back, the further I go, the more nervous I get. I spoke to, not so much anymore, but when I was first diagnosed and like kind of like a year out, I spoke to a lot of ladies like kind of online and like ovarian cancer forums and things like that. And I mean, a lot of ladies I speak to have unfortunately passed away, they've not made it. I mean, other ladies have like had a reoccurrence, so they're maybe going through like their second or third reoccurrence, and I'm lucky that I've not had to worry about it since. Still have my checkups every 6 months, and I think it's kind of like a year before they change to yearly. I'm not too sure, but I'm sorry this video has been so long and rambly, but I might need to make this into 2 parts. I'm not too sure. I'll know when I edit. But thank you so much to anybody that's kind of stayed with me for so long and really didn't expect to kind of like ramble away so long. But if you like this video, then please subscribe or like this video. Hopefully my next video will be a bit more happier. But thank you so much, and bye for now. Bye.